A family medicine center in Hudson, Quebec has decided to shut down because of the province's controversial Bill 2. The medical clinic says 3 of its 7 doctors will no longer be practicing in Quebec, and that could affect close to 12,000 patients.
It's almost like a family, and that's part of Hudson. And I'm getting emotional now because I know how many people this is going to affect.
The clinic is connected to a pharmacy, physiotherapist, and nursing services. James Perry comes weekly to get his wife's medications. He says the bilingual clinic offers a one-stop shop for everyone, including the town's aging population.
It's a vital part of the community, and it would be devastating, tragic, catastrophic.
4 generations of Christy Lovett's family have been going to the Hudson Clinic.
It would be absolutely devastating. Here, I know that if my daughter has a fever in the morning, I can call them up and I will very likely get an appointment that same day. And even if they can't, they'll still try to help me.
Bill 2 has been in place since the end of October. It ties doctors' salaries to performance indicators, including the number of patients they see and how much time they spend with each one. The GMF Hudson Clinic says Bill 2 would compromise the care they give.
It has been a pretty devastating situation in our clinic, and I'm sure in many others. We will be forced to give unsafe care to our patients. We'll be told who to see, when to see them, how often to see them, how quickly to see them.
More than 15 years ago, Frank Royal and a group of people raised funds to buy the land the clinic is on and move the former Hudson Medical Clinic here before it was a GMF, with the goal of having all the services in one place. He says many people are dependent on the clinic.
People need to come to the clinic frequently for care. It's not a question of coming once every year or every 2 years for the physical checkup. They rely on their family physician to keep them alive.
The Quebec Health Ministry says work is being done to demystify Bill 2. Talks with the province and federations representing doctors are ongoing to potentially amend some parts of the law. But McCarty says nothing but the law suspension would be sufficient.
The only way things will be looked at is if the entire law is suspended permanently and that everyone comes back to the drawing table.
For the patients, they can't understand the province's rationale.
I can't imagine a piece of legislation that has been so destructive to such an essential part of Quebec society in my lifetime.
The Hudson Medical Center says each patient will be contacted directly by their family doctor, who will tell them whether or not they'll continue to practice and what their next steps are. The clinic is set to close on April 1st.